All right, today we're tackling a health issue that affects nearly half of all adults. It's something that usually has no symptoms at all, but here's the good news, you can absolutely get it under control. We're talking, of course, about high blood pressure.
Just let that sink in for a minute. If you're in a room with another adult, it's basically a coin toss whether one of you has high blood pressure. We're talking about a staggering 116 million people in the United States alone. But the real kicker? So many of them have absolutely no idea.
And even for the millions who do know they have it, the situation is, well, it's pretty concerning. Only about 1 out of every 4 of those people actually has their condition under control. You see, this isn't just a knowledge gap, it's a control gap, and the consequences of that gap are serious.
You know, this quote from the CDC really gets to the heart of the problem. There's a reason they call high blood pressure the silent killer. It's because you can't feel it, you can't see it. The only way you can possibly know you have it is to measure it.
So what is it that we're actually measuring here? Well, it's pretty simple, really. It's just the force of your blood pushing against your artery walls. Think of it kind of like the water pressure in a garden hose. If that pressure is too high all day, every day, eventually you're going to wear down the hose. Your arteries aren't all that different.
So if it's silent, how in the world do you find it? Well, it all comes down to knowing your numbers.
Okay, this table is your roadmap. The CDC has a great little stoplight analogy for this. Normal, that's anything under 120/80. That's your green light. You're good to go. Elevated is your yellow light, kind of like a warning shot. But stage 1 or stage 2 hypertension, which starts at 130/80, that's your red light. The top number measures pressure when your heart beats. The bottom number measures it between beats. And trust me, both of them matter.
But where you get those numbers is super important. You know, a single reading at the doctor's office, it can be really misleading. A lot of people get what's called white coat hypertension, where your blood pressure just spikes because you're nervous about being in a medical setting. It happens. That's why the latest guidelines really stress the importance of measuring it outside the office. Monitoring your own blood pressure at home, that's now considered the gold standard for getting a true, accurate picture.
All right, so we know how to find it. Now let's get into why it's so incredibly important to deal with. What's actually happening inside your body when that pressure stays high, day after day, year after year? So the fundamental problem is this. That constant high pressure is like a non-stop stress test for your arteries. It makes them stiff, hard, and way less flexible. And when that happens, you've basically created a traffic jam in your own circulatory system. It slows down the flow of blood and oxygen that every single one of your vital organs needs to survive.
And that traffic jam can lead to some truly catastrophic pileups. It can starve your heart muscle of oxygen and cause a heart attack. It can burst a blood vessel in your brain and cause a stroke. It hammers the tiny, delicate filters inside your kidneys. It can even damage the blood vessels in your eyes. And what's becoming clearer and clearer from the research is the scary link to dementia and cognitive decline.
Look, this isn't just a problem for individuals. It's a massive public health crisis. We're talking about 116 million adults in the US alone, an annual cost of over $131 billion. And globally, it's the #1 preventable cause of death. The sheer scale of it is almost hard to wrap your head around. Okay, that was the heavy stuff, I know. But here's the good news, and it is really good news. Hypertension is controllable. The power to change this whole story doesn't start at the pharmacy. It starts with how we live our lives every single day. This is your first and honestly your most powerful line of defense. And these 5 things right here, this is your action plan. Eating a heart-healthy diet like the DASH plan, getting active for at least 150 minutes a week, keeping a healthy weight, limiting alcohol, and finding ways to manage your stress. These aren't just little suggestions. They are proven, powerful ways to lower your blood pressure.
Now let's just zero in on one of the biggest game changers on that list, sodium. The goal is to get under 2,300 milligrams a day, but for most adults, the ideal limit is even lower, around 1,500. And you got to remember, most of the sneaky stuff doesn't even come from your salt shaker. It's hiding in processed foods, canned soups, and restaurant meals. Reading those labels is absolutely key.
Now, making those lifestyle changes is fundamental, but let's be real. For a lot of people, it's just not enough on its own, and that's where medication comes in. This isn't a sign of failure. Think of it as a partnership between all your hard work and the amazing tools of modern medicine. You know, the decision to start medication isn't just about one blood pressure reading anymore. It's about your total, overall risk.
If you have stage 1 hypertension, your doctor will likely use a calculator to estimate your 10-year risk of having a heart attack or stroke. If that risk is 10% or higher, then yeah, medication is usually recommended right away along with those lifestyle changes. It's a much more personalized way of doing things.
When medicine is the right call, there are several great options to start with. Things like ACE inhibitors, ARBs, calcium channel blockers. Your doctor has a whole toolkit, and they'll pick the one that's best for your specific health profile. The goal is always to find the right tool for the job.
So what happens if one drug just isn't cutting it? Well, doctors follow a really logical step-by-step approach. They don't just guess. They might increase the dose or add a second medication from a different class, or maybe even a third. If your blood pressure is still stubbornly high after all that, it's called resistant hypertension, and that's the signal it's time to bring in a specialist.
Look, getting your blood pressure down to a healthy level, it's not a one-and-done deal. It's not a finish line you cross. It's an ongoing commitment to your health. So what does that actually look like day in and day out?
Real, long-term success lives inside this continuous loop. You've got to have regular monitoring at home. You have to take your medication exactly as prescribed. That's huge. You need to be consistent with those lifestyle changes. You need to see your doctor for annual reviews. And you have to keep the lines of communication open with your whole healthcare team. Every single one of these pieces is vital.
And here's a really crucial point, especially for women. Having high blood pressure during a pregnancy isn't just a temporary issue that goes away after the baby is born. It actually points to a significantly higher long-term risk for heart disease. That's why the new guidelines are so clear. These women should have their blood pressure checked at least once a year for life.
And the best part of all this, you are not alone on this journey, not by a long shot. There are some fantastic tools out there to help you. The American Heart Association has printable trackers you can use. The World Hypertension League has a website that helps you find a scientifically validated home monitor you can trust. And community support networks can connect you with other people going through the exact same thing.
So, we've walked through what it is, why it's so dangerous, and exactly what you can do about it. The power to manage this condition is real, and it's completely within your reach. So the only question left is, what's your first step going to be? What's one thing you can do starting today to take control?
Maybe your first step is buying a home blood pressure monitor. Maybe it's just deciding to skip the chips tonight. But whatever you do, please make sure your very next step is this. Talk to your healthcare provider. It is without a doubt the single most important conversation you can have for your heart, your brain, and your entire future.